Most dogs that eat grass are not sick, but the pattern matters. Sudden, frantic grass eating, or grass eating followed by repeated vomiting, can mean something more is going on. Some dogs simply enjoy the taste and texture. Others may be responding to boredom, instinct, an empty stomach, or mild digestive discomfort. The important question is not just whether your dog eats grass. It is how often it happens, how urgently they do it, and what else is happening at the same time. In this video, you will learn how to separate ordinary grazing from a warning sign, what the available research suggests, which outdoor risks owners often overlook, and when a call to your veterinarian is the sensible next step. Welcome to Instin Paws, where we separate dog facts from dog myths. Let's start with the most common explanation, because it is simpler than many owners expect. Some dogs eat grass because they like it. Fresh grass has a texture that many dogs seem to enjoy chewing. New growth can be soft, moist, and easy to pull from the ground. Some dogs appear especially interested in cool morning grass or fresh spring shoots. Others investigate it for the same reason they sniff leaves, sticks, and every new patch of ground during a walk. It is part taste, part texture, and part exploration. For a dog spending time alone in a yard, grass can also become something to do. Chewing and foraging are naturally engaging behaviors. A bored dog may graze in the same way another dog carries a stick, digs at the soil, or patrols the fence line. None of this requires an explanation involving illness. A few relaxed bites during a walk, followed by normal behavior, normal appetite, and normal stool, are usually very different from a dog urgently tearing through every patch of grass they can reach. A popular belief says dogs eat grass because they know it will make them vomit. It is a tidy explanation, but the evidence does not support it as the usual reason. Research suggests that most dogs do not appear ill before eating grass, and most do not vomit afterward. That does not mean nausea is never involved. It means deliberate self-induced vomiting should not be the default assumption every time a dog nibbles the lawn. Grass eating is also commonly seen in dogs eating complete, balanced diets. So although nutritional problems can exist in an individual dog, a vitamin or mineral deficiency should not be the first conclusion based on grass eating alone. The safest interpretation is that grass eating is a common canine behavior with several possible explanations. The behavior becomes meaningful when you look at its frequency, intensity, timing, and the symptoms around it. The moment grass eating happens can give you useful context. It cannot diagnose a problem, but it can help you recognize patterns. Morning grazing may happen because the grass is fresh and appealing. In some dogs, frantic grass eating first thing in the morning may also occur alongside an empty stomach, repeated swallowing, lip licking, or yellow bile vomiting. If that becomes a recurring pattern, discuss feeding timing and stomach discomfort with your veterinarian rather than simply assuming the grass is the cause. Grass eating immediately after meals is worth noting if it happens repeatedly, especially if it comes with burping, restlessness, drooling, or discomfort. During walks, a few opportunistic bites are often just that. The grass is there, and your dog is curious. In a yard, grazing that appears mainly when the dog is left alone may point more toward boredom than illness. Timing gives you information. It does not give you a diagnosis. What matters is whether the same pattern repeats and whether your dog seems completely normal before and afterward. Dogs are not strict meat-only eaters. Their ancestors and wild relatives consume a varied diet, including plant material found while foraging or inside prey. Modern dogs may retain some of that broad scavenging behavior. That does not mean your dog is trying to recreate a wild diet every time they chew a blade of grass. It simply means plant eating is not automatically strange or unnatural for the species. For many dogs, grazing may be an ordinary extension of sniffing, scavenging, and exploring the environment. Normal behavior is not the whole story. In some dogs, grass eating appears alongside signs of mild nausea or digestive discomfort. Watch the whole dog. You may see lip licking, repeated swallowing, drooling, stomach noises, pacing, restlessness, a temporary drop in appetite, or a dog that keeps asking to go outside. When several of these signs appear together, grass eating may be part of the episode rather than a harmless preference. That distinction matters. Grass eating itself is not the diagnosis. It is one clue among several. A dog who calmly nibbles 2 blades and continues the walk is giving you a very different picture from a dog who wakes suddenly, rushes outside, gulps grass, retches, and refuses breakfast. If the second pattern happens once and your dog quickly returns to normal, observation may be reasonable. If it repeats, worsens, or is joined by vomiting, diarrhea, pain, weakness, or appetite loss, veterinary advice becomes more important. So why do some dogs vomit after eating grass? One likely explanation is physical irritation. Long blades swallowed quickly and with little chewing can irritate the throat or stomach. A large amount of fibrous material can also trigger vomiting simply because it is difficult to process. But grass appearing in vomit does not prove the grass caused the original problem. A dog may already be nauseous because of something scavenged, a sudden diet change, a stomach bug, or another digestive issue. The grass may come back up because it happened to be in the stomach at the time. One isolated vomit followed by completely normal behavior is different from repeated vomiting, repeated retching, blood, weakness, or a dog that cannot keep water down. The pattern after the vomiting matters just as much as the grass itself. Here is the simplest way to separate ordinary grazing from a pattern worth investigating. Example 1. Your dog takes 3 or 4 bites during a walk, then moves on. They eat dinner normally, have normal energy, and their stool is unchanged. That usually fits ordinary grazing. Example 2. Your dog eats grass only when left alone in the yard and stops when you join them with a toy or begin a training game. That leans more toward boredom or self-entertainment. Example 3. Your dog suddenly pulls toward every patch of grass, swallows it quickly, drools, and repeatedly licks their lips. That urgency, especially if it is new, deserves closer observation. Example 4. Your dog wakes early, eats grass frantically, vomits yellow fluid, then acts normal. If it happens once, note it. If it becomes a recurring morning pattern, speak with your veterinarian about stomach irritation and feeding timing. Example 5. Daily grass eating appears alongside appetite loss, diarrhea, abdominal discomfort, lethargy, or weight loss. That is not a simple grass habit anymore. The additional signs are the reason to seek veterinary guidance. The shift in frequency and intensity is often more useful than the behavior alone. Occasional grazing becoming daily, compulsive, or frantic is a meaningful change. So here's the simplest rule to remember. Occasional grazing is usually about the behavior. Sudden, frantic, or repeated grazing is when you start watching the whole dog. Grass eating does not automatically prove a vitamin deficiency. It does not automatically prove low fiber, worms, poisoning, or a deliberate attempt to vomit. Any of those issues could be present in a specific dog, but the behavior by itself cannot identify them. Jumping straight to a supplement, dewormer, diet change, or home remedy can distract from the information that actually matters: how your dog feels, what else has changed, and whether the pattern persists. Even when grazing itself is harmless, the location may not be. Lawns treated with pesticides, herbicides, weed killers, or fertilizers can leave residues that dogs should not ingest. Public grass may contain animal waste and parasite eggs. Damp areas can contain mold, and nearby puddles or standing water may carry bacteria or other contaminants. Sharp grass-awns, including foxtails in some regions, are another concern. Their barbed structure can work into the mouth, nose, ears, skin, or paws and may require veterinary removal. A dog that suddenly sneezes repeatedly, paws at the face, shakes the head, or develops swelling after being in dry grass should be checked. There is also the risk of toxic plants mixed into a lawn or garden. If you are not sure what has been sprayed, planted, or left on the ground, do not let your dog graze there. The safest grass is untreated, clean, free of waste, and free of sharp seed heads. Age changes how carefully you should watch this behavior. Puppies explore with their mouths and may eat grass simply because everything is new. But they are also more likely to swallow soil, stones, mulch, fertilizer, or other objects along with it. Their smaller bodies can be affected by toxins or dehydration more quickly, so vomiting, diarrhea, weakness, or suspected chemical exposure deserves prompt attention. In senior dogs, A brand new repetitive behavior deserves more notice than a lifelong habit. A senior dog who suddenly begins grazing daily, especially with appetite changes, weight loss, increased thirst, vomiting, diarrhea, or reduced energy, should be discussed with a veterinarian. The concern is not that grass eating has one specific meaning. It is that a new behavior can be part of a broader change in health. If the behavior feels different from your dog's usual occasional nibble, track it for the next 48 hours instead of relying on memory. Write down how often it happens, roughly how much grass is eaten, and whether the dog grazes calmly or urgently. Record the time of day and whether it happens before breakfast, after meals, during walks, or when the dog is alone. Note any vomiting, retching, diarrhea, appetite change, stomach noises, lip licking, drooling, water intake, energy level, and signs of pain. Also record treats, table scraps, chews, recent food changes, and anything your dog may have scavenged. If the lawn was recently treated, write down the product if you know it. A short phone video of the behavior can be useful, and a photo of vomit or stool may help your veterinarian understand what you saw. Observation is reasonable only while your dog otherwise seems comfortable, alert, hydrated, and able to eat and drink. It is not a reason to delay care when vomiting repeats, pain appears, the abdomen looks swollen, or your dog becomes weak or unresponsive. You do not need to stop every occasional nibble of clean, untreated grass. But if grazing becomes frantic, compulsive, difficult to redirect, or happens in an unsafe area, step in calmly and redirect your dog. If frequent grass eating has become a habit, start with practical management. Supervise outdoor time. Increase walks, sniffing opportunities, training games, and safe chew activities if boredom may be involved. Redirect grazing with a toy, a food reward, or forward movement on the walk. Avoid treated lawns and areas contaminated with waste. If your dog tends to eat grass when their stomach is empty or around a particular feeding schedule, do not make major changes on your own. Bring the pattern to your veterinarian, who can advise whether meal timing, diet, fiber, medication, or further testing is appropriate for your individual dog. A treat pouch can make Leave It training smoother because rewards need to arrive quickly and consistently. A portable water bottle can also reduce the temptation to drink from puddles or standing water during long outdoor time. Neither product replaces veterinary care. They simply make day-to-day management easier. Contact your veterinarian if grass eating becomes frequent, compulsive, or suddenly different from normal. Call if it repeatedly leads to vomiting or if it appears alongside diarrhea, appetite loss, abdominal discomfort, unusual weakness, lethargy, dehydration, or unexplained weight loss. If you speak with your veterinarian, bring the notes, photos, or video you collected. Details about when the behavior started, how often it happens, how urgent it looks, and any changes in appetite, digestion, energy, diet, medications, or possible chemical exposure can help determine whether further evaluation is needed. None of these signs identifies one specific disease. Together, or persisting over time, they suggest that something beyond simple preference may be happening. Some signs should move faster than a routine appointment. Seek urgent veterinary attention for repeated unproductive retching, a visibly swollen or painful abdomen, collapse, difficulty breathing, severe weakness, blood in vomit or stool, repeated vomiting with an inability to keep water down, or any reason to suspect pesticide, herbicide, fertilizer, toxic plant, or chemical ingestion. If you know the product involved, take the container or a clear photo of the label with you. Do not induce vomiting or give a home remedy unless a veterinarian or animal poison professional specifically instructs you to do so. For most dogs, grass is simply something to taste, chew, or investigate. The behavior alone is rarely the red flag. The pattern around it is. Watch the whole dog, not just the grass. Notice whether the behavior is occasional or compulsive, calm or frantic, and whether vomiting, appetite changes, diarrhea, pain, weakness, or weight loss appear with it. That is what helps separate harmless grazing from a reason to call your veterinarian. The useful question is not, why did my dog eat one blade of grass? It is, has the pattern changed and is my dog otherwise well? And speaking of things that can look mild on the surface but signal something bigger, During hot weather, vomiting or sudden weakness can be more than an upset stomach. Watch heat stroke in dogs. 7 early warning signs next to know exactly what to look for. Until next time, stay curious and keep listening to what your dog is trying to tell you.